You did. You sent it to David and Judy.
Okay. Okay. I'm going to call to order the Eureka Springs Hospital Commission regular meeting on September 20th, 2021 at 6 o'clock p.m. Can I get a roll call? I am here. Ty Burden.
Barbara Dix.
Leva Murphy.
Kent Turner.
Angie Shaw.
And we have Bill Couch joining us on Zoom. Has everyone had a chance to read the minutes for the regular meeting, August 16, 2021? If so, may I have a motion to accept the minutes as written?
I move approval.
Second.
All of those in favor say aye.
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 All of those opposed. Okay. It does not look like we have a public comment tonight. So with that, we will move to the treasurer's report.
Giving you the usual sheet. We didn't spend anything, though. All we did last month was make $430.28 worth of interest. So we have a checking account balance of $1,719.01, money market balance of $1,447,911.81, and a CD, because there's no interest on CD, only every 3 months. The CD is the same as it was last month, $435,780.98.
Very good. Does anyone have any questions for Kent concerning the treasurer's report? Okay. With that, I'll move on to committee reports. And Kent, did you have anything new in the financial committee?
No, work has just been progressing. I did stop by and meet the new AP person and the new general ledger person, just to make sure they knew who I was, and offered my assistance to anything they could do. I'll probably do some more communication with everybody between now and this meeting next month.
Okay, very good. And marketing, do you have anything, Leva, you'd like to comment on outside of the CEO report?
No, I think that she can cover
She's
it.
gonna
It's pretty
cover it.
exciting, though.
Yeah, sounds really exciting. I would just say on the Quad C, the only really new thing that has come up is that we have received word, it's been in the news as well, that sometime in October, Medicare, CMS, is going to require that we mandate the vaccine for all employees in order that we can not be penalized payments. Nobody knows exactly how this will roll out. I did consult Megan briefly on this one, because my understanding was that if we mandated the vaccine, that would be possibly against Arkansas law, although that's not clear. But she said that if they do roll that out as a mandate in order to participate with Medicare, that would be something that we would have to follow no matter what. So we probably all need to be thinking about how we'll roll that out and how we'll implement that. And we do have some staff, although it's dwindling, that is not vaccinated and does not want to be vaccinated. So we may need to reach out to them and see if there's anything we can do to help them with this potential mandate coming down next month. So really, that's just something in the future. It's not for right now, but just so that everybody's aware and we can be thinking about that. So I think with that, any questions for me on Quad C? Okay. So with that, I think we will move on to the CEO report. Angie?
I did give you a copy of the report. Starting from the top, just regarding COVID-19 and vaccinations. Of course, we've seen an increase of outpatient COVID testing since mid-August.
I don't think your microphone's on.
Oh, the blue light is on.
Blue light on.
Yeah, it's on.
Yep. Can you hear me better?
Yeah, that's better.
We have seen an increase in outpatient COVID testing since mid-August. We have actually have one of our LPNs that conducts our COVID testing Monday through Friday, 8 to 4. That has definitely helped out with our ER nurse staffing. We continue to hold vaccine clinics for the community at our clinic that's across the street, and those are every Friday from 10 to 1. And we still have a need. Right now, we're averaging around 40 vaccines during that clinic. Nursing, swing bed, and respiratory. We are still seeking to fill open nursing positions. We are currently down 4 full-time nursing staff. We are actively interviewing for those. We are also actively advertising to fill the swing bed case manager position that we also require to be an RN. Good news is that we did bring on a second respiratory therapist, Brian Harp. He started on August 16th, so we now have RT coverage 7 days a week. And I've also been speaking with a speech therapist, Lee Harville. She will be coming on board to help grow our speech therapy program. A current start date has not been set at this time, but I will announce that once it's finalized. Moving on to ER, we did promote Joy Kennedy. She will be taking over as ER director effective October 4th. Joy has been a nurse at the hospital since 2014. She is also a member of the Inspiration Point Fire Department as an EMT and firefighter for the past 7 years. She has a lot of knowledge, and looking forward to her coming on board full-time. The ER census has remained steady. Our numbers each month continue to grow. We haven't seen numbers as strong as in years, honestly, with how many patients that we're seeing through our ER. So it's been very busy. And the LPN that also does the testing helps with the ER when she's not testing. So that's been a blessing. Currently, lab is, of course, with all of our COVID testing, they're extremely busy. They're using antigen test, Abbott ID, and our Cepheid testing kits. Since August 1st, we've had approximately 750 tests with about 373 positives. Radiology. Our outpatient radiology testing continues to be steady. Ultrasound studies are increasing. We are able to complete echoes Monday through Friday now. The Amy, our director, has completed her certification. Unfortunately, I have to report that our CT scanner is down at this moment. The replacement part is scheduled to land tonight at the airport around 10, and they're bringing it immediately over to change that out. So we should be up and running hopefully after that.
Okay.
Regarding the clinic, I do have some new news on this. We did receive our notice today that Medicare has processed and approved our application for the clinic at the 25 North site. So we are able to move forward with the process. The next step is to get Medicaid's approval, and then we will begin applying to commercial insurance groups. In the business office, we've actually had several new hires. Scott Canavan is our business accounts manager, and he'll be working with Bill, our CFO. Savannah Hudson is our new accounts payables clerk. And then we did hire a scheduler that started today. Her name is Kristen Ferris. In the Health Information Management Department, Bree Fisher has stepped into that director's role full-time now. However, she is still working with Scott and Savannah regarding the business office duties. Bree's goal is to work towards bringing coding back in-house. Right now, it's outsourced, a part of it, and we're working on that so we can end that contract. And then we also hired a new medical records clerk. Her name is Ricky. Human Resources has been getting ready for open enrollment. Jody has been working with the HR at the city level to get those dates set. And then we still have several openings available and advertised. Regarding marketing, as you all know, we had a logo contest, and that ended July 31st. We've received several entries. It was a hard decision, but we did choose a winner. The winner was Nathan Coy. He had a very simple yet modern logo, and we are excited to start incorporating it into our use at the hospital. The first focus is going to be new signs for the hospital. That's going to be the electric signs by the road and, of course, over the ER and the main entrance, as well as our plans are to print T-shirts with the new logo for staff, and a lot of ideas that we have for marketing our facility and getting that new logo out into the community. And then regarding maintenance, housekeeping, and dietary, IT, Becky, our facilities director, is finalizing the roofing repairs for the Brown House. She's working on getting that and getting a date scheduled. We also did receive all the new flooring, and we are currently trying to schedule a time for them to start installing that. This last flux of COVID has kind of put a hold on that. Dietary actually has hired 2 new staff members, so the department is fully staffed at this time. As well as, due to the demand on IT, we have hired a second IT system specialist. So
Very good.
that will be very helpful for Drew. And then just some general information. This past month, I really wanted to focus on employee retention. And after reviewing the wage scales and discussion with Bill, our CFO, we were able to make that important decision of increasing wages. These increases were warranted by where staff fell on the wage scale and their experience at their current position. I felt that focusing on retention and making sure the current staff were where they needed to be was the important path to follow, and then going forward with bringing new staff in under a new wage scale. And it has been well received, of course. We are, like I said, actively interviewing for several positions, and we're actually getting some applications, so it's good. And just so I can show you the new, the winner of our contest. This is
Oh, yeah,
the one that was chosen.
nice.
So I don't think you've seen it yet, Bill, but let's see that there. But we are going to definitely start incorporating that into a lot of changes.
Are we going to have a big unveiling, an announcement? Never let anything pass you by.
Nope, we actually met with them and with the winner on Thursday, so it will be announced in the paper this week, so.
Okay. Does anybody have any questions for Angie besides me?
I got a couple.
Okay, go ahead.
Wage, so you made wage increases?
Yes.
Good.
Yes, they went into effect this last pay period.
And I guess that was it, because I was going to say, I think we ought to have something big for the unveiling of the logo. I mean, more than just in the paper. I think we ought to get the mayor out there and have a ribbon cutting, or whatever the heck you do. I mean, it should be something that,
We're going to get the signs up.
Yeah, when the new
Yeah.
signs are up, maybe that would be
Yeah.
a good
well,
idea.
you can do it before you get the signs up by just letting everybody know that it's coming. I mean, just make that twice the size of that and say, this is invite everybody to come and see our new logo. I mean, it's never pass up an opportunity to get people to notice what we're doing. That's my opinion. And just putting it in the paper is fine, but, you know, if you just, it's a 15-minute task. I'm sure the mayor has time. You know, commissioners we could all be there, and just kind of make it an event. And let people know that we're going to change the signs, and that it's a new look and it's a new day.
Okay.
Yeah.
I
Yeah,
just think it's a good idea.
Yeah, I agree with that, and having the logo now also allows us to start some other marketing that we've been really needing to do with Dr. Tandon, and that we do have cardiology at the hospital now, and some things like that, and the CT scanner and all of it. I agree, but one big, event to start it all off, I think would be very
This
positive.
town will eat up the fact that we use local artists to do it. They will.
Yeah. Yeah,
Great idea.
I think that's a good idea. I had a question just for clarification more than anything. You said that since August 1st, we did 750 COVID tests and 373 were positive?
That's 50%.
That's over 50, or, yeah, no, that is 50, too short of 50%.
Yeah.
Yeah. That's an incredible,
Yeah, that's a bad ratio.
yeah, there's not been anything close to that. That's why I was just questioning a little bit. I don't, maybe we ought to double check.
Well, I will
Okay.
get back with,
And sorry, I'm not being picky, I'm just,
Oh, no.
that's quite eye-opening if that's the case.
If that's true, it's surprising to me.
Yeah, that's highest that I've
And it
ever
could be-
heard anywhere.
that the numbers I received were,
Yeah, yeah, there may be some
I'll
nuance to that
I
in some
will
way.
verify that. so.
Okay. And then my other question was on the new primary care clinic that we're planning on opening very soon with the nurse practitioner. Do we have a date for that now that we have Medicare? Are we going to roll that out with just Medicare? Are we going to wait for the insurances or going to try to, I didn't know if you had kind of a plan on that as
Well,
far.
we were going to reach out to Medicaid,
Uh-huh.
Medicare, and then after that.
After that.
Then we were going to,
Oh, great. So that should be pretty soon because once you have that Medicare number, Medicaid should come pretty quickly, I think.
we're hoping.
Yeah, okay. Very good. Well, thank you so much.
I do have.
Yes,
one
go
more
ahead.
thing. I know it.
Ken.
Did you get the email from me that we had not paid our rent on the,
Yes.
okay.
Yes.
I'm sure it fell, I just told them it fallen through the cracks, I was sure, so.
Yeah, and they took care of it.
Okay.
so.
Ladies, do you have any questions for Angie? No. Okay. If there are no further questions, then we'll move on to the CFO report with Bill Couch. Bill, can you hear us okay? Oh, I think you're muted again, Bill.
I did.
There we go.
So I apologize. Hey, I've been troubled hearing, but if y'all have a question, please be direct and I will answer. We had a good month collection-wise, and due to the changeover in the accounts payable clerk position, we just didn't write as many checks as we did the month before, so our expenditures are down. Now, I apologize for that. I mean, we're on a cash basis right now for what I'm reporting to you, and we are very close working with Roger Bowen to we're almost through August. So we're hopeful that we can get caught up here in the next 30, 45 days, and so we'll be reporting to you by the commission meeting, real-time accrual basis accounting. But we still got some issues that need to be resolved there. But we did have a good collections month. We had a good month going in September, except for the last week. So I'm pleased with that. Our gross revenue, our cash position eroded a little bit, but that has to do with the checks not clearing that had been written. And so it's right off the bank statement. It has nothing to do with anything other than that was the position at the end of the month. But our gross revenue for the month of August, $1,441,000, is the greatest that we've had since January. And it's very close to last month, $1,436,000. So I'm pleased with that. That will turn into money pretty soon. And so I'm pleased with the position that we're in cash-wise. Obviously, I always wish it were better, but we're dealing with a cost-based reimbursement system for Medicare and Medicaid. So that's where we are. Does anyone have any questions or concerns?
I was just wanting to clarify the $390,000 payment from Medicare, when you thought we'd receive that, and if you could talk about what that is just a little bit and explain that.
Yes, you bet. What that is just merely a catch-up. It's a year-to-date interim report based on last year's cost report. And so they catch us up based on that cost report and anticipated expenditures against that. And I'm comfortable with that number. We hope to have it would be a reach to have an interim cost report by the time they want to do a second interim review. But we've got a couple of months, so I think we can make that. And that would true us up based on actual expenditures versus revenues and get us in a real picture with Medicare and Medicaid. And I'm hopeful that we can do that. So, Ty, does that answer your question?
Yes, yeah, and I noticed that wasn't in the numbers this month. When will that hit the bank account, do you think?
Should be soon. I would say within 45 days at the most. So, worst case, it'd be next month.
Okay.
But I would hope it'd be here by the end of the month.
Okay, very good. That sounds great. Does anyone else have questions for Bill concerning the CFO report?
Not concerning the CFO report, just a quick question. How much more are we going, do we need Roger Moore still? Do we need Roger Bowen?
Yes, we do.
Okay.
We do, Kent. I think we really do for the time being. Scott is doing a great job. It was a great hire. He seems to be very intuitive, and he's asking the right questions. So I'm very pleased with Scott Canavan, I believe is his last name. And so he's doing a great job, and I will, what little expertise I have left, I will lend him, and we'll get him in a proper position. But yes, he's asking, like I said, the right questions, and everything's going well. And we'll use Roger, I think, through the rest of this year off and on, but not as extensively as we had up to this point. As soon as we've got some issues settled and we're comfortable with the accounts payable position and some other things. But once we're there, I think we'll be fine.
Okay, the reason I asked that question is he had asked how, he's got somebody else wanting to hire him, and he was asking how much more we were going to use him. And I've not, he asked me that Friday of last week, and I have not called him back until I could talk tonight. So.
I kind of got that. I saw the same email, Kent,
Yeah.
and I was a little, I didn't understand, but he'd been on vacation. He'd been out of pocket for a couple of weeks. And I hope that we can use him off and on to get Scott and Bree trained up on actually posting journal entries and making sure they're correct. And that gives me something to work from. And with that said, I hope Roger will stick around and help us for a little while longer. And I understand that he's a man in great demand. We just need him for a little time longer.
Okay, I was waiting for that. I'll call him back tomorrow and tell him that we're not going to need as much as we've needed him in the past, but we still will need him some. So.
Yes,
Okay.
I think so. I know he's as tired as I am of posting entries back to February. So I think we're done with that. We are actually working in August right now.
That's tremendous.
And so I'm very pleased with that, and I think we'll be caught up very, very soon.
Thank you.
Okay, very good. Any other questions? All right, then we will move on to Commissioner's comments. Leva, any comments?
I'm good, thank you.
Okay, Barbara?
I'm good too.
And Kent?
I will just make or a comment about two comments that I've heard. Again, I had two people that went through our ER and also ended up in the hospital, and I got calls from one receiving very good remarks on how they were treated and how things went. So I thank the hospital staff tremendously for that. That's the kind of work we need to do.
Yeah, and actually my comment is along the same lines. As a practicing physician in the area, I can't tell you what a difference it's been over this past year that I'm able to send patients to the hospital and they're willing to go. And for the first time since I've had my practice in 5 years in this area, many people prefer to go to Eureka Springs Hospital over the other hospitals. And that's a first for me this past year. So really happy with the way everything's going so far. I think Angie's done a great job in this very odd time of nursing shortages. I just want to commend her for stepping in there and doing what has to be done in order to keep the hospital open, including covering some nursing shifts that we really were hoping she would not have to do, but we've gotten into some situations where there was just no other choice. And so I really thank her for that and keeping us going. I also want to, thank the staff. I think the staff is doing a great job. I get, all kinds of compliments about the staff now, as in the past it was really the other way for most of the time that I've been in the area. Also, I have to go on with my campaign, just encouraging people to be vaccinated. We got some very, very good data from Pfizer this morning saying that the vaccine is extremely helpful for the prevention of morbidity with COVID-19 in the 5 to 11-year-olds. So we expect that the FDA will be approving that by the end of the month, and the hope is that children who want to be vaccinated and whose parents want them to be vaccinated will be able to be vaccinated by Halloween, which would be really great. We're collecting more and more data on the vaccines all the time, and we're still seeing extremely low side effect profiles. One report I read recently, even though you can have a breakthrough case, and everyone's heard that you can have a breakthrough case even when you're vaccinated, your chances of actually dying from COVID-19 once you have been fully vaccinated are somewhere in the neighborhood of 1 in a million. And so that's part of the reason it's been so difficult on making a decision about booster shots, is because when you're fully vaccinated, your chances of dying are already so low. So anyway, I just say that because I know there's a lot of information out there, and I just want to clarify that from the scientific journals and from the scientific community and the general hospital community, we still support vaccine and do believe that this is the primary and possibly the only way to get out of this pandemic. So I just want to encourage everyone to get a vaccine. We're still doing vaccines every week, and we still have Moderna and Pfizer. So we actually have a choice of the vaccines at the hospital, and we expect to be vaccinating children very soon. So with that, can I get a motion to adjourn?
So moved.
Second.
All in favor?
Aye.
Very good. Okay, so we're adjourned. Hey, just for clarification on the minutes, I did vote yay for the minutes.
Okay.
Don't know if I...
Thank y'all.
Thank you.
I think I said it, but...
Thanks.
Anyway, just to clarify for the minutes.
Just so you're
I
not
might have said it really soft.
surprised.
I don't know what this is. It says hospital
Ball
commission,
at
but
our Saturday
it's
meeting.
like
Like
a
a
ear thing.
recorder or something.
Also,